recording, so whatever.
Okay, so I'm going to listen right here. So what I perceive as a lot of sadness. There's so much sadness in here. And so I would switch over at this point to energy work. I don't know if you want me to do that or not. So oh man. So this is like the ancestors coming through you on both your mom's and your dad's side. And it just feels like crying. It's like so emotional. And they're like, we're sorry we can't be there for you. We know this is a hard time. You'll make it through this. Everything is okay. You don't have to worry. You are the change maker. You are part of the change that's going on in this world. And it's a really big deal. This is a really big deal. It's bigger than you know. And that's why it feels like a lot. It feels like a lot because it is a lot. You are a change maker. And so the advice that they're giving is just to settle into it, to accept it, to actually what they're saying is to receive the change. So it's not like you have to like do anything. There's not like, it's like you are receiving. That is the way, that is the way of your nature. That is the way that you contribute to everything that's going on, is by receiving the change, allowing it to come through you, allowing yourself to be transformed in that matter. There we go. That's good. All right, and so now I'm going to go back and listen again and see if there's something. Now there's something structural that's going up to the head. It's going up to the temporal bones. So I'll go into cranial sacral. And so there's something in the body that's saying like, I don't want to be here now. Like this is too much for me. I need something else. Okay, take a deep breath. And let it go. That's good. All right, so I'll come back to the midline, to the breastbone. We'll come up to the sagittal suture. So this is pulling, it's like into the head. It's semi-structural, but it's also the midline energetic field. So we're just gonna allow that to pull down to be more grounded. There we go. That's perfect.
That was so subtle, but I could actually feel like saliva releasing in my mouth when you did that. Like
Pulling down.
Obvious shit.
Yeah, so there's a little more heaviness on the left than the right side, or it's like in the field, it's not in the body. So it's just a little bit of imbalance. There we go. All right. So now I'm going to listen again in the midline. There we go. That's good. That's good. So now I'm going to follow down the midline. So the reflex for the hiatal hernia is activated. There's a pulling up under the breastbone in the epigastrum. So I'm going to release the respiratory diaphragm, and we'll see if that's going to be enough to... Are you having any GI stuff, like burping or acid reflux or anything like that? Indigestion, heaviness in the stomach, difficulty digesting food, low appetite, anything like that?
All of the above, except I would say the appetite goes from like not feeling like I need food to like feeling like I need to eat a lot.
Okay, yeah. So are you familiar with hiatal hernia?
Sort of.
So the way that I explain it is the way my dad explained it to his patients. So let's say this is a respiratory diaphragm right here. And let's say this is the esophagus and my fist is the stomach. So there's a hole in the diaphragm that the esophagus goes through. The stomach's supposed to be below it, right?
It comes up through like
It comes up through. Yeah. And so then you can get like yesterday I had a patient who was like, I feel like I can't breathe because her stomach was like everything was pulled up into the chest cavity. And so what I do is to see if it'll resolve itself by kind of like relaxing the tissue around it. If it doesn't, then we do a manual thrust to pull it down. But yeah, because that stomach needs to stay below the diaphragm. So the reasons the stomach can raise above the diaphragm are multiple. It could be, a structural reason, injury, the tissues aren't moving right, stuff like that. It can also be low stomach acid. And so in midlife, our stomach acid we tend to produce less. And so when there's less acid production, then the acid is what tonifies the lower esophageal sphincter, which is also called the cardiac sphincter. And so when there's lower stomach acid, or less stomach acid is what I mean to say, then there's less tonifying of that sphincter. And so there's a tendency for stomach acid to come up, stomach to be pulled up. It's just the relationship. There we go.
It likes to talk. It likes to let you know.
Talker, yeah. That's good. So that was enough to resolve it. I'm going to gallbladder. So gallbladder is that, there's your belly button. All right. So, and there's the sphincter of Oddi. And so gallbladder is like kind of congested. You can feel, here's the rib cage. Gallbladder's like this. So gallbladder is supposed to be kind of like tucked up under the rib cage. And when there's congestion, when it's not squirting out the bile correctly, then it will distend. And so you can feel this is a common bile duct that goes between here, and this is a sphincter of Oddi, where it injects into the duodenum. And so I'm going to release Oddi first. So also the other thing that comes into Oddi is all the pancreatic enzymes. And so if you're having a spasm of the sphincter, you're going to have problems with digestion. And because we need bile and the pancreatic enzymes to digest our food. And so I'll release this sphincter. Then, of course, the common bile duct receives the bile not only from the gallbladder, but also from the liver. And so remember, the liver produces a constant drip of bile. And then part of it goes into the gallbladder, which is a reservoir. Oh, that's releasing really nicely. And then this is where the gallbladder hooks up to the common bile duct.
I can feel that.
Of course you can. Yeah. And so for the gallbladder, it holds that bile until we eat. And then it releases it as a big bolus into, just making sure we got this, into the duodenum so we can digest. So that bile is really important for emulsifying fats. And so if we're not getting that big bolus release, then we're going to have a hard time digesting fats. And what causes the gallbladder to squirt out all that bile when we eat is having a hot tummy, is having enough acid, right? Because that gives a signal. When we bring in food, we chew it, stomach is supposed to release a lot of acid, then the gallbladder's like, oh, somebody's eating around here. I better get ready to do my job. And so if we have low stomach acid, then the gallbladder's not going to get that signal very well. And we're not going to get a good squirt going. So that's coming through. So we don't have to do everything all at once. We just have to do enough. So because the body can take care of the rest of it. We just do our part. All right, so it looks like you're having some drainage. You're swallowing. Is that right? Or what's happening?
Am I swallowing?
Is it coming up or going down? You had a couple big swallows. So sometimes after working on the head, there'll be a little drainage. There we go. That released. All right, so I'm coming back to the midline.
I don't feel like anything's coming up.
Okay, good. That's good. Okay, so I'm going to listen to the kidneys here and on the rib cage, and so we're checking for motility, which is that embryologic movement pattern of the kidneys. So I'm going to put my hands here, and that's pretty good. That's pretty good. I would adjust right here. There's a little bit of stiffness in the lymphatic watershed at the bra line. So I don't know if you want me to do like an adjustment or not. So I would adjust there because that's going to help bring up the drainage and stuff. So this is the hug adjustment. Are you okay with that one? Mm-hmm. Okay. So you're going to get...
I don't know what it is, but I trust you.
That's the one. That's the one where you give yourself a hug. Let's bring this up just a little bit. There you go. That's good. And then I'm going to give you a hug on top of it. You're going to take a deep breath in, and when you breathe out, I'm going to give a little push through here. Okay? So you're going to tuck your chin, lift your head. Lift your head. Good. All right. And so now you're going to take a deep breath and let it go. Are you okay? Did that hurt?
It didn't hurt.
It did. It was just surprising.
It's just,
Was it surprising?
It's like a pop.
It was like a little pop. I didn't even have to do a push. I just opened it up. And that's when you know it's really structural, right? If you don't have... Dr. Baral always said, the adjustment should be easy. And so I shouldn't have to use all my might to force an adjustment. That's not a structural issue with the joint. That's not a joint issue, I should say. That's something else. The adjustment should be just like that, where you just put tension on the joint and the joint goes, thank you.
Yeah.
All right, so let's go back and listen. All right, so that's perfect. So now we're going to go down. All right, and so we're pulling into here, which is going to be like the ileocecal valve, it feels like. A lot of digestive stuff, girl. Mm-hmm. You're like, I know that. I could have told you that. All right, so we'll come into, so it feels also like low tone. So, of course, the ileocecal valve is where the small intestine and large intestine hook up. So all of the sphincters in the body are autonomic. They're all under autonomic control, which means that's automatic, part of the nervous system. We don't have to think about that in order for it to work. It just works. All right, so this is not resolving fast enough, and so what I want to do is see what's going on here. Why is that? What's keeping it from resolving? Okay, and so this of course, large intestine, the emotion that goes with large intestine is like dogma, stubbornness, like very kind of like concrete thoughts, like strongly held belief systems. And so there's something, again, going back to this feeling like I'm overtaxed, like I have too much going on. And so what we want to do is like give you some options so that life can just slow down a little bit. And so just in your heart, in your mind, just remind yourself, it's okay if I do less. It's okay if I do less. And so there's something in you that's like, no, that's not okay. Everybody's counting on me. I don't want to let anybody down. I really want to be a helper. I want to be a good girl. I want to be contributing to society. I want to be doing my part. I want to be out there doing my part. So there's something in you that really wants to contribute, that has this like real helpful spirit about you. And it's like you see something that needs to be done and you're like, okay, I'll do it. But what's happening is that it's too much. It's too much. And your body is noticing that it's being taxed by this approach. So say this out loud. It's okay to do my part.
It's okay to do my part.
And so your body's like, my part's too much. It feels like too much. I can know what my part is.
I can know what my part is.
It's okay if my part is less now than it was in the past.
It's okay if my part is less now than it was in the past.
It's okay if my part is different now than it was in the past.
It's okay if my part is different now than it was in the
Yeah.
past.
So there's this fear that's coming up in you that's like, I'm afraid if I slow down, if I do anything different, then I'm going to lose traction. And I like the trajectory I'm on, and I don't want to lose my trajectory if I slow down or if I give responsibilities to others or, that kind of thing. And so just imagine the possibility that you can slow down, you can go at a pace that's right for you and continue the trajectory. It doesn't mean the trajectory's off. It just means that the pace is off. Do you follow what I'm saying?
Mm-hmm. This is so applicable and on track.
Well, it's your body.
Unbelievable.
Your body's like, oh, let me tell you how it is. Yeah. So I think your body's really happy about that idea of just like slowing it down a little bit, like really staying on the trajectory, but going at a pace that's right for you now, which may not be the same as next month or next year or whatever. But right now, it needs to be a different pace. So say this out loud. I can know the pace that's right for me.
I can know the pace that's right for me.
Yeah. It's okay if I go at a pace that's right for me.
It's okay if I go at a pace that's right for me.
Going at a pace that's right for me is not a sign of weakness.
Going at a pace that's right for me is not a sign of weakness.
Going at a pace that's right for me is a sign of strength.
Going at a pace that's right for me is a sign of strength.
It's okay if people understand.
It's okay if people understand.
It's okay if people don't understand.
It's okay if people don't understand.
I can do what's right for me.
I can do what's right for me.
It's not all up to me.
It's not all up to me.
By doing what's right for me, I'm doing what's right for others.
By doing what's right for me, I'm doing what's right for others.
Yeah. It's okay if I relax.
It's okay if I relax.
It's okay if I relax.
It's okay.
Your body's like, what? Does not compute.
The words did not even come out clearly.
What is that? I don't even know what that means.
I'm trying to picture myself on a kayak.
You're like, what would that be like? Kayak?
Filling up my jacuzzi.
Jacuzzi, relax. Yeah. All right, so now we want to go back to original. So was there an original time that it seemed like it wasn't okay to relax? Was that point of conception, prior to conception? So this is going to prior to conception, previous life. Was that in the 20th century, 19, 18, 17, 16, 100 to 16, 50, 60, 70, 80, 70, 75, 76, 76. Was this original time, were you in this original time represented by male, female, conception, birth, birth to 5 to 10, 5, 6, 7, 7-year-old female? Anybody else in the story? Your mom, your dad? You have a brother, yeah. Anybody else? Was your mom? In the story, your mom was your dad was your mom, your brother was your sister in the story. Oh, you guys were like, it was like you were fleeing. You were fleeing over the water. You were in a boat. You were fleeing from certain disaster, certain devastation. There was like so much anxiety. Like there was an imperative. We have to get out of here. We have to get out of here now. It was like a very dramatic, very like spur of the moment, like move, like pulling up roots. Everything was changing forever, and it was just like that. And there was something in you that was like, do it or die. Do it or die. What's going
weird
on?
Because last night or this morning I had these really vivid dreams, and I was on a boat with my parents, and it was in like a place I didn't recognize, and I was having anxiety and didn't know where I was, and was trying to like move, and like there was this, I went up the staircase and it was like blocked by a ceiling, and I I'm like, oh, I'm going the wrong way. I'm going the wrong way. I was trying to figure out like where we were, and
Yeah.
that's so wild that that's what you are sensing or feeling.
Yeah. Yeah, it's like everything in your being is playing into this, right? It's like your body, so that's the original assumption or contract, right? This idea that I have to keep this pace because if I don't, I'll die, right? And so your body is saying we can't go on at that pace. And so we have to let go of that originating assumption that to slow down means death. Of course you're going to keep pushing, right? Because you don't want to die. And in the original case, there was absolute danger that you were fleeing from. But now there's not. The body just hasn't it just hasn't it doesn't have the awareness that you are safe now. Right? It is safe for me to let go of that original imperative to move. Say that.
It is safe for me to let go of the original imperative to move.
Yeah. It is safe for me to slow down now.
It is safe for me to slow down now.
That pace saved me in the past.
That pace saved me in the past.
It is not saving me now.
It is not saving me now.
Yeah. It's okay to let go.
It's okay to let go.
I am a new person now.
I am a new person now.
This is a new life now.
This is a new life now.
I am safe now.
I am safe now.
I make my contribution by slowing down.
I make my contribution
There you
by
go.
slowing
Perfect.
down.
Just that. That is perfect right there. I make my contribution by caring for myself first.
I make my contribution by caring for myself first.
And out of that springs my caring for others.
And out of that springs my caring for
Perfect.
others.
Perfect. 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 Yeah. Very, very good. It's a big deal. That's a really, really big deal. Okay, so this is the ovary. This is the left ovary, and it's saying I'm done. And so I think that it's indicating that it's done with its life of ovulation. It's retiring.
Aww.
And so there's something really important about honoring. So in the anthropological literature, there's no rite of passage for menopause. Did you know that? No cultures have a rite of passage for menopause.
Really?
None.
That's shocking to me.
They have rites of passage for everything else. For puberty, for marriage, for death, for everything. Every major milestone in life. Nothing for menopause. And I said, why is that? And it's because people died. That was like they didn't keep
that far?
or right afterwards they died, right? So it was just like, oh, you're just going down the drain. You need to move.
Yeah.
Okay. And so it wasn't imperative in times gone by because the life cycle was so short. And then they would just have their rite of passage for death instead. But we keep going. And so it's good to have an honoring of this time when the body, again, switches paces, switches gears, switches sort of emphasis and focus. And so what we want to do is to honor what has come before, what is happening now, and what will be to come. And so a lot of times, especially the ovaries, they'll go through this phase of being like very insecure, where they're like, if I don't produce, why am I even here? You know, 'cause they're all about production too. Mm-hmm. And so we want to reassure them that you have meaning, you have import. Even if your life of producing, reproducing is coming to an end. That we are grateful for what came before. We are grateful for what is happening now. And we are grateful for what is yet to come. This is not the end. It is just the end of a cycle. The end of a cycle is the beginning of a new cycle. And that is a blessing. That is grace. That is the nature of things. And we enter into that fully with gratitude. With gratitude. Even if it's uncharted territory and there's no rite of passage, we can create our own. There we go. Very good, very good, very good, very good. Hello, tummy.
It's saying thank you. It's very grateful.
Nice. And come back up to the chest. There we go. All right, so we'll just end with the occiput. Yeah. Yeah, so I feel your body has like a lot of Thanksgiving. Like there's a lot of, hi, Tommy. So that's really good, right? Those are borgarismas. That's saying your body has gone into parasympathetic dominance, and that you can move forward in your day as
That's what that means.
peace. Right. When the stomach growls, that's called borgarismas, and that, of course, only happens. That's parasympathetic. That's all parasympathetic.
That's so interesting because it always happens when I start dowsing people
Oh.
and doing emotional clearing work.
There you go. Your body's like, I love it.
That's amazing.
Give it to me. Good work today. Good work.
Thank you.
Yeah, thank you.
Felt wonderful.